The Presidency has presented a total of 6,102,737 cedis 80 pesos to the Ghana Medical Trust Fund, otherwise known as the Mahama Cares Fund. The amount represents salary contributions from President John Dramani Mahama, political appointees, presidential staffers, and deductions from officials who failed to meet the asset declaration deadline. The donation was formally handed over during the ceremony at the Presidency, where Deputy Chief of Staff in charge of administration, Honorable Nana Oye Bampo-Addo, underscored the government's commitment to supporting Ghanaians battling non-communicable diseases. Speaking at the event, Nana Oye Bampo-Addo, who presented the check, recalled that President Mahama launched the Ghana Medical Trust Fund on April 29, 2025 to help cover treatment costs for non-communicable diseases that are not fully catered for under the National Health Insurance Scheme. According to her, the Mahama Cares Fund requires about 3 billion cedis annually during its first 3 years of operation to effectively support patients in need.
The fund requires approximately 3 billion cedis annually over its initial 3 years. Ladies and gentlemen, what moved all of us most deeply was what the president did next. He did not just launch a fund and leave the room. He himself pledged 6 months of his own salary as seed funding. He then turned to us, his appointees, and invited us in the spirit of the reset agenda, in the spirit of leadership as sacrifice, to contribute our 1 month's salary to the fund. Our President John Dramani Mahama showed the way, and colleagues, we have followed with a patriotic answer. We answered the call. Today, we are gathered here to formally present the proceeds of that answer. The Comptroller and Accountant General has already transferred the amount of 6.1 million cedis to the Ghana Medical Trust Fund, comprising the President's salary donation and our contributions as presidential appointees and staffers, and deductions for those who failed to meet asset declaration deadlines. Colleagues, I want to take a moment to acknowledge what this has meant in practice. These salary donations came with real sacrifices, bills that had to wait, plans that had to be deferred, commitments that had to be renegotiated. We all knew the costs, and we paid it anyway, because this is what the reset agenda of President John Dramani Mahama means.
The administrator of the Ghana Medical Trust Fund, Ajua Obuobia Dako Opoku, outlined 4 key strategic pillars that will guide the implementation of the initiative aimed at supporting Ghanaians living with chronic non-communicable diseases.
The needs assessment guided our 4 strategic pillars. 1. Patient support. To provide direct financial aid to patients suffering from chronic non-communicable diseases. The President puts it better when he says no Ghanaian should be denied life-saving treatment due to financial hardship. 2. Infrastructure and equipment. We are bringing modern technology to our healthcare centers. We are setting up 3 state-of-the-art cardiology centers at Kolebu, Konfanochi, and Tamale teaching hospitals. We have also begun distributing dialysis machines and ICU equipment to facilities nationwide. 3. Specialist workforce development. Infrastructure alone does not save lives. People save lives. Through partnerships with the Ministry of Health, the Ghana College of Physicians and Surgeons, the Ghana College of Nurses and Midwives, and the Ghana College of Pharmacists, the Trust Fund has invested significantly in specialist training. Our vision is that within a few years, every region in Ghana will have at least 10 specialists to provide advanced care for people living with chronic diseases. The fourth pillar is medical research. Addressing chronic diseases effectively requires investing in both knowledge and innovation. We need to better understand the patterns, causes, prevention, and treatment of the conditions affecting our population. With evidence from research, we can shape policy, improve interventions, and build sustainable solutions.